Thank you. Hello, everybody. My name is Brian Dowd. I'm the Deputy Executive Director at the Department of Community Health and the business owner, and have been for about 3 years now, of electronic visit verification. I just want to start off by thanking everybody for joining us tonight. I know it's 6 p.m. on a Thursday, and we like to do some evening meetings. This is our second town hall in the evening this week at 6 p.m. because we understand people have things they're doing for the day. They may have family members that are working or other responsibilities. So we do try and provide a diverse meeting schedule, but we also understand that that is a bit of a burden on you guys as well. So we're going to try and be respectful of your time. We're going to stick to an hour, and we really want to thank you for your participation today. We start every presentation with the mission of the Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? Well, you guys asked us for specific town halls associated with participant direction or self-direction, and we heard you. You also asked us to make sure that the fiscal intermediaries were included, and we heard you there again. So we broke it up by fiscal intermediaries for you guys. You also asked for the fiscal intermediaries to participate in the presentations, which I am so thankful for that they are on tonight and will be doing part of the presentation. So you won't just be listening to me. So we accomplished that as well. We will also be posting this presentation, which has contact information, as well as the recording from tonight, onto our DCH EVV webpage, and we will go over that a little bit later. So we're going to do a DCH EVV overview. We're going to talk about EVV impacts to self-direction. Then we're going to turn it over to Acumen to give an EVV overview of their system. Then I'm going to come back on and talk about next steps, and then we'll do a Q&A. So we will do a Q&A as much as we have time that permits. I am going to ask in the beginning, and I'll say this again at Q&A, if you could keep your Q&A questions to broad topics or frame them in a policy way or larger way, and not get too specific about your individual circumstance, that would be great. I'm very cognizant and aware of things like PHI and HIPAA and all that kind of stuff. And I just don't want too much personal information going out on a webinar that's recorded and then posted. So make sure you just speak in broad principles. If you need to talk about something very specific, then you can contact me at my work email, which I think most of you guys have. I've certainly fielded probably about 300 questions in the last 6 months from participant-directed families, or we will give you the DCH EVV mailbox, of which I answer and monitor as well. So where are we when it comes to, and this is going to be very specific to Acumen. So if there are other folks that are on the line that don't have Acumen as their FI or our traditional providers, again, we welcome you. All of our presentations for EVV are open to everyone, and that has been our principle and guiding philosophy since the start of this for the last 3 years. But I do want to let you know that this is going to be very much targeted to Acumen and self-direction. It's all about self-direction, particularly as it comes to Acumen in this presentation tonight. So where are we? We are working to integrate DCH into the NetSmart or TELUS system. We are actively doing that right now. Their system is called DCI, and I don't want to steal any of their thunder from their meeting, but we'll hear about that a little bit later. But we are currently holding bi-monthly meetings to ensure that integration is going well and there is a smooth transition forward to EVV. Also, You probably have already heard me tonight call TELUS NetSmart and NetSmart TELUS. TELUS is now NetSmart. So if you hear anybody from the department or Acumen or anybody talk about NetSmart, just know that that is also TELUS. So that is our EVV solution. So where are we currently? We are smack dab in the middle of our recruitment campaign and system refinement. We are daily taking tons and tons of questions and comments from you all, and we're trying to improve the system. We're also actively trying to enroll traditional providers who have not been enrolled, and we've been calling them. And we're also reaching out to individuals through every known channel that we have to get folks on board and get folks using the system. Right now, we are continuing to move forward to a July 1st implementation for mandatory claims processing. We have a go, no-go decision on that next week, where we will look to see whether or not we move forward with a July 1st date. If we choose not to move forward with a July 1st date, I want to be really clear. We will have a mandatory claims submission through EVV. That is not something that is going away. That is something that DCH, our legislature, our governor's office, everybody is very committed to full adoption of EVV. That is something we as a state are very committed to. We want to make sure that we're in compliance with the federal government and the 21st Century Cures Act, and we want to make sure that we're utilizing the EVV to the best of its capacity to enhance member outcomes and ensure that our members are getting the services as outlined by the waiver and in our state plan. So if we do delay, it will be very targeted delays, and that mandatory claims processing will be coming shortly thereafter. So what are the EVV required services? I get this question every day and have probably gotten it every day for the last 6 months. They are the services that are associated with PSS and CLS. They are CPT codes T1016, T1019, T2022, T2025, and S9122, depending on what waiver program you are participating in, or if you are a family member with a child that's on GAP, you wouldn't actually be on this call because we don't have any self-direction in the Georgia pediatric program. It is something that is just specific to the home and community-based waivers. Self-direction does not exist anywhere else in Medicaid but the home and community-based waivers. So it's really not relevant to GAP, but it is relevant to all of the T codes you see up here, which are CLS and PSS. Now, we only self-direct in CCSP source and ICWP PSS. When you get into now in comp, we self-direct a whole bunch of services, but the only ones that we're self-directing are related to CLS. You will not see on this list community residential alternative because it's not an EVV service. You won't see community access individual because it's not an EVV service. Community access individual is not an EVV service. So for us as a required service, what we do is these services here. Personal PAR, personal assistance retainer funds, will continue to come out of your CLS budget, but for our purposes, for the oversight purposes of DCH related to EVV, we won't be looking into that as part of the EVV system. Next thing I want to go over is key fobs or fixed devices. Initially, the Department of Community Health for a couple of years was saying we were going to make available key fobs and fixed devices, specifically for individuals whose workers did not have a smartphone and who the individual did not have a landline. We started that about 3 years ago. And in the 3 years that we implemented the system, really got the contract, did our choosing, and started implementing, the key fobs and fixed devices just became a kind of a dinosaur. States don't use them, and they're not an industry standard for use, and they're no longer even suggested for use by the federal government. So we made a business decision that we were not going to allow for key fobs or fixed devices in Georgia, as with most states. We do provide an option for an interactive voice response, which is just a really fancy way of saying a telephone line. That's a telephone line that is in your house. It's a fixed telephone line that is tied directly to your house. So if your worker doesn't have a smartphone, you have some options. One option is telephony. You can use your telephone. This presentation will be posted to the DCH website, and you can click on this button and it will bring you to the forum. You can also just go under the member page at the bottom of the page, and you will see the request to use an IVR if you want to use an IVR. To date, we've gotten less than 20 requests in for IVR. We have approved all but one. And I'll be honest with you, the one we didn't approve was from a traditional provider where they said the member and the workers had no cell phone. And when we verified what was on there, we found that the worker did absolutely positively have a smartphone, and there was internet connectivity at the member's house, and the member had a hard line. They had a telephone line. So we denied that request to use IVR, but the rest we have been able to approve, and you'll be able to see the conditions of that. I'm also really excited to let you guys know that let's say your workers don't have a phone, and maybe you don't have a landline. That's okay. I got a solution for you. Georgia Lifeline. Medicaid members who are active Medicaid members are eligible for a smartphone for free through the Lifeline Services, which is a federal program that provides phones free of charge. It also provides data free of charge, internet data for the smartphone, way more than you would need to run an EVV system in a month. You are granted with the use of your Lifeline phone. The Lifeline phone also comes with free texting and free voice capacity. Again, this presentation will be posted on the DCH website, and you can click on this link. If in lieu of a key fob, you could get a free Lifeline phone and place that phone in your house. And when your workers need to use it to sign in and out of the app for DCI, they could do so. Okay, now let's talk a little bit about impacts to self-direction. So what's changing? What's changing is we have a federal mandate that requires the use of EVV and capturing EVV required data, which is that clock in and clock out, who's performing the services, who is receiving the services, the location at clock in and clock out, and what those services are or what those tasks are. So what's also changing? We're doing time and data tracking via the mobile application as opposed to paper timesheets. What's not changing? The waiver rules. Nothing specific with EVV has changed the waiver rules. If waiver rules change, they go through the normal process, which is public comment period and going to the DCH board, and then negotiation with CMS. What's also not changing is where and how you receive services. I have been asked countless times, well, my family member, my loved one, my whomever, they don't always receive their services in the home. Services may start at the community, at a day center, or at a grocery store. I may drop them off somewhere. No problem. You can continue to clock in and clock out at addresses other than your home place. We have no problem, and there is no restrictions to the system with you clocking into a location other than your home place. Do we use data analytics and do we track clock in and clock out for reasons of program integrity? Absolutely. But if it is a normal, valid place for a clock in and clock out to occur, and it's supported by your plan of care, your documentation, there is absolutely nothing to worry about with clocking in and clocking out at a location other than the house. How much you get paid does not change, and how your employees are paid does not change. Also, your fiscal intermediary doesn't change. If you have Acumen now, you still have Acumen with EVV. You only change your fiscal intermediary if you decide to change your fiscal intermediary. Some other common questions and concerns we've gotten, I want to go over those real quick before I turn it over to Katrina at Acumen, is facial recognition a requirement? I heard from countless people that Acumen was requiring facial recognition. That we have verified with Acumen, and I'm sure they may even talk about it, that is not a requirement. There are options for being able to verify the service that you are receiving. And you do not have to use facial recognition. Although I have heard from a couple of people who actually like the facial recognition. I don't think I personally would, but they seem to really be liking it. Another common question and concern I get often is, I think you're tracking me. And the answer to that question is simply, no, we're not. We're not tracking you. Nobody here is tracking you during the day. We don't have the resources. We don't have the bandwidth at the state. And quite honestly, we're just not that interested to track you through the day. That's the God's honest truth. We are doing what is required by the Federal Cures Act, which is we are showing your location at clock in, and we are showing your location at clock out. Many people have asked me, well, what if I turn my phone to airplane mode after I clock in? I don't care. As long as you turn it back on when you clock out, so you don't have a problem with the requirements that are associated with EVV. The federal requirement and a condition for continued receipt of waivered services for PSS or CLS is compliance with EVV, which means we need to know the location at clock in and clock out. Is DCH or Acumen providing payment for equipment? No. Unfortunately, the federal government will not allow us to provide or pay for equipment, but I did just give you a link for a free smartphone that is a federal phone, not run by DCH, and that is completely free, including the minutes and the data usage. Can my employee or aide bill for training time? I got this question just today. No, unfortunately, CMS will not allow for reimbursement for training time. What if me, my family member, or an authorized representative cannot sign in or is not available at the time of clock out? The person just is incapable of signing in or signing out, which happens. That's not unusual. And the family member might not be there. Maybe the aide is dropping the person off at community access group or adult day health. That is fine. We have talked about that with Acumen. DCI has an override for those situations, and then you just do the manual approval. And that, as long as it's not every single time you're clocking in and clocking out, then that won't even throw up a red flag. We understand that there are situations by where people might not be able to clock in and clock out in a day. Do I have to have a schedule for my employee or aide? So I'm going to be, once again, very forthcoming here. I was very concerned about 6-7 months ago when I really started intensely doing trainings for EVV at the number of self-directed members who told me I don't have to have a schedule. A schedule is not required, and it's not something I have to do, because that is just honestly not true. We build home and community-based services as a federal requirement under the waiver via an assessment and a plan of care. And that plan of care is to meet unmet needs in the community. And meeting unmet needs mean you have to have some sort of schedule so we can look to see when the services that taxpayers are paying for should be delivered. So that is very important that you have a schedule. Do you have to maintain to the schedule exactly? Of course not. We all understand that there may be instances where there is variation that's needed. The aid needs to be there for a longer period of time, or heck, sometimes you don't need the aid, right? Maybe somebody comes home, or the member is going to do something with somebody else that's not with the aid, and maybe your schedule needs to be shortened for an hour or two. That is common and not unusual, and that is also allowed. But you do need to have a schedule to guide what is expected via your plan of care. So another common question I get is, well, what about the paper timesheets? We want to continue to use paper timesheets. Related to EVV services, we are moving away from paper timesheets. We are moving to the federal requirement of electronic capture. Now, you do not need to document things on paper that are already in the DCI system. If we do auditing from the Department of Community Health or from CMS, they will look into our EVV system to get any verification they need of things such as tasks performed or time in and time out. Another question that I got that I think it was just a confusion point, but something that I want to take an opportunity to clarify again here on this call, is I've had several people approach me about travel time. Travel time is not allowed or reimbursed under the waiver. Travel time is included in the rate for services delivered. Now, if your aid is doing a service on behalf of the member, and that is out of the house, let's say they're picking up the medication and bringing it to you from the local CVS, then that is allowed. They can clock in, and while they're picking up the medication and they're bringing it to the member in their house, that is performing a service for the member. That is a task performed for the member. But here's what you can't do. The member cannot clock in from their house while they drive 30 minutes to your house and add 30 minutes onto their day. That is not performing a service directly for the member. That is travel to and from the member to deliver services. Also, I have heard from several members, more than 10 now, about what is called flex time or extra time, where in order to supplement the worker's pay, or I had 2 members tell me that they used flex time so that the members could buy items for their family member. That is not allowed. You cannot bill times to the waiver or to the state of Georgia and taxpayers for what is not a direct service to the member. You cannot bill an extra half an hour so the worker gets a little bump or a bonus. You cannot bill an extra hour so the worker gets money to take the member to lunch. These are real circumstances that I have heard from family members, and I want to take this opportunity to let you guys know that that is technically fraud. I don't think that in any instance that it was given to me, it was actually fraud, because fraud indicates intent, that you are intending to take money from the taxpayers for your personal use. I think these individuals were simply confused about the policy, and that's why we are not only re-emphasizing it in this town halls, but we are going to be doing additional training both at DCH and DBHDD related to areas of concern in consumer direction from what we have seen from billing practices. So please just be careful to know that when you're clocking in and clocking out, it should be for services for the member. All right, I talked way too much. So now I'm going to pause and I'm going to turn it over to Katrina from Acumen. And Katrina, I forget your title, so you're going to have to tell people what it is, and I can't look on my email. but I know I'm going to guess client services representative in the South. Something like that.
Thanks, Brian. My actual title is Vice President of Southern Operations. And
I knew there was something in the South there.
Yeah, no problem. Yep. And I have on the line with me Nikki Klein, who's our Executive Director of our Georgia business. We are both located right here in Georgia. So good evening, everyone. Thanks for attending. Thanks to Brian and the DCH team for hosting this event tonight. I know we've gotten a lot of requests for this, so just want to thank everyone for participating. You know, there's been a lot of anxiety about EVV as we approach the go live. We've actually been preparing for this for several years, so there's definitely been a lot going on up to this point. Is this my slide to take over, Brian, or is somebody else going to do the actual slides? Let me make sure
I was going to advance the slides for you. If you just tell me next slide, that'll work, okay?
All right. Well, we're right where we need to be, so thank you. So those of you who've been with us for several years might remember when we rolled out DCI. That was all done in preparation for EVV. For those of you who are familiar with using DCI, you can expect to see a few new features rolled out probably next week. And for those of you who have not started using DCI yet, we'll talk about what steps you need to take to get started with that. So who is Acumen's EVV vendor? DCI is Acumen's EVV vendor. It does meet the EVV requirements prescribed by the 21st Century Cures Act. And it is what you'll use to submit EVV compliant shifts for your community living services codes if you're in the Now and Comp program, and if you're in the ICWP or CCSP program, this is how you'll use, is what you'll use at your personal support services, those PSS shifts. Those are the two services that it's required for. You can certainly use the DCI mobile app for those other services, for those of you who are in the Now and the Comp program, but it is not required. All Acumen clients currently have access to DCI. So if you're an active client, if you're an active employee receiving payment through Acumen, you already have an account. If you need assistance with your access, if you haven't gotten on there yet, you need a little bit of help with that, please let us know. You can email my team directly, our team here in Georgia, at enrollment@acumen2.net. Add that information here for you before we step away for the, probably add it in there in the chat, Nikki, if you could do that for us. So next slide, please. As I've said, we've been preparing several years for this. We actually rolled out DCI in December of 2017. And shortly thereafter, we began live webinars showing you how to use the online portal and how to use the app. Those live webinars continue today, and we will continue doing those live webinars moving forward. Find even for our newer clients as they come on board, they like those live webinars to show how to use those, so we don't foresee those live webinars stopping. In March of 2018, our local staff began doing in-person town hall sessions throughout the city. We did those most of 2018, all of 2019. Obviously in 2020, we were not able to do those town hall sessions, but we continued with those live webinars. In June of 2018, our local staff, we found that we had a certain number of people who wanted to attend the town hall sessions, but just weren't able to. So we started doing one-on-one sessions in individuals' homes as requested. And then we did those for approximately 2 years. Again, we had to stop with the pandemic. And since then, we've started to do one-on-one sessions with our clients virtually. This past March, we began working with DCH on the integration, and we began working with our partners at TELUS on the integration. We're also working obviously with DCI. DCI is also working very well with TELUS on the integration pieces. So there's a lot of communication and collaboration that's been going on behind the scenes. In fact, we actually just met with our partners at TELUS a few hours ago. Nikki and I did to go over the claims processing through the TELUS system. They've been really, really helpful and really great partners through the process. This month, June of 2021, we're going to make some feature updates, and for those of you who are current users of DCI, you'll see these feature updates that I'm going to talk about in a couple minutes, released next week most likely. These feature updates are going to include a signature at sign out option and an offline mode option. And then if you use our DCI portal, you'll see that reason codes will be added to those portal entries. I'll get into the details of that in just a couple minutes. And again, as Brian said, July 1 is EVV go live. Next slide, please. So these are just some of our existing resources for training. So our website, acumenfiscalagent.com. If you go to the EVV Resources Center, you'll see all of these. These are links to particular training modules. So if you just want to know how to update your app automatically, or how to use Picture EVV, it will really give you just kind of a brief overview of how that particular piece. Again, you can also sign up for the live webinar. If you go to our website, and again, that's www.acumenfiscalagent.com, under the events tab, that's where you sign up for a live webinar. And we do have those ongoing. Once you get access to our DCI system, so you'll get your login. Once you log into the DCI portal, you'll find some additional training materials there. So if you go to the help section, there's about 25 to 30 different training videos. And we're always adding to that that are behind that login under the help section. Next slide. Beyond the links we just showed to you, we are going to, like I said, continue with those live webinars. They're going to be ongoing. We're also getting prepared to publish some frequently asked questions on our website, and I just asked, we're probably going to be sending that to everyone's email, so that will be coming from Acumen to the email that we have on file for you, most likely within the next week. We're also going to be providing a training link. Again, this will be emailed directly to our clients, our active clients, and it will be posted to our webpage, and it'll be a link to a recorded webinar. So that you can watch it at your own convenience if you don't want to attend a live webinar. We are also ready to post updated trainings that'll address new features that I'm going to be talking about. And we continue to provide our one-on-one assistance. Our agents are working with individuals every day to answer questions or to do a training specific to them to help you walk through logging on to the app, downloading the app on your phone, what it looks like to submit a shift in that environment. So we'll continue to provide that one-on-one assistance. Next slide, please. Okay, so let's get into some of the new stuff that we have going on. First of all, the way that your employees are paid is not going to change. Acumen will continue to complete all the claims processing on your behalf. So as long as you're using DCI, as long as you're using the EVV mobile app for your PSS and CLS services, we are going to continue to submit that claims processing for you. Like I said, Acumen and DCI are integrating with TELUS, so you don't have to do anything directly with TELUS. Our client verification options is one of the changes that you can likely expect to see likely in the next week. And this is with the verification options that are available in the mobile app. Currently, you need to verify the shift at clock in and clock out on the mobile app. The change is that you will no longer have to do it at the point of clock in. You will have to verify the shift at the point of clock out. Another change that we have coming is that right now at the point of clock out, you can choose to use either a PIN or a password or facial recognition to verify the shift. Next week, one of our new features is that we're adding the ability for you to choose a signature option. So there'll be that option there as well. And then as Brian mentioned, you can also not do any of those verification methods. As the employer, you can go onto the portal and manually approve that shift. And that option is available as well. Next slide, please. So the reason codes are going to be a new addition that you'll see in the web portal beginning next week. I'm going to take a step back and just kind of talk about what reason codes are. We know that community living services and personal support service shifts have to be submitted using the EVV mobile app or the landline if you're approved to use a landline. There might be a situation when your employee can't submit their shift in an EVV compliant manner. That's when these reason codes come into play. So for example, if your phone battery dies, there could be any number of reasons why you wouldn't be able to submit that shift in an EVV compliant manner. And this is the exception to the rule. But in these certain cases, you can go to the web portal, and that's acumen.dcisoftware.com, and we have a whole lot of users on that right now. Log on to that, and your employee would be able to submit that shift for PSS or CLS on the web portal. There's an additional field that's going to be added, and again, this is going to be live next week, where you have to basically explain the reason why that shift was not submitted in a EVV compliant way. That reason code is then sent to the state through TELUS when we bill on your behalf to explain why that shift wasn't the compliant way. So that is the exception process that is available to you. And again, that field, that reason code field, is going to be available in the portal effective next week. The offline mode is also going to be available next week as well. The DCI app will have, what we call this offline mode. And that's basically if you're using the EVV mobile app and you are not connected to the internet, your employee is still going to be able to use that EVV app, clock in and clock out of their shift the way they normally would. There'll be a bar at the top of the app that will let them know that they're currently in offline mode. That shift data is going to be held until they get a Wi-Fi or a cellular data connection. The next time your employee logs into the app and they have a Wi-Fi or cellular data connection, the app is going to prompt them to sync that shift so that the shift data is sent to us for processing. So I know a lot of folks have been concerned about locations. Every time my employee comes to my house, they don't have an internet connection. This resolves that issue for you. Next slide, please. Thank you. So here's some Acumen and DCI resources. Again, you can sign up for the trainings by going to acumenfiscalagent.com and going to that events tab. So you'll be able to find a live webinar on there. Please utilize our resources. And then also please look out for an FAQs that are going to be coming out soon, and a supplement to our training, which will show you what the process looks like to incorporate these new features that we're talking about today. And again, that's going to be sent to everyone's email. If we have your current email on file, you should be expecting to see that from Acumen to your email within the next week. We will also have all of these resources posted to our website as well. My direct email address is here, as is Nikki's. And then our customer service line is here as well. We do have, Nikki and I are currently in state, and we have 11 agents who are currently in state with us as well. And they are all very well versed on training on the EVV resources. Next slide, please. So your next steps, if you're not currently using our DCI mobile app, please make sure that you check out those resources, sign up for a webinar, review the materials that we're going to be sending you next week. And we're really, really encouraging everyone to get started using this before July 1st, just to kind of get in the habit. I know they say it takes about 30 days to get to learn a new habit. This is all real time. So when your employee starts their shift, they need to clock in at the start of the shift. When they're ending that shift, they're going to need to clock out. So that particular piece, I think, is going to be new if you're not currently using the app. Do you see a lot of questions here, Brian? Do you want to start going through questions, or did you want to?
Yeah, in just one sec. So let me go over just some where you can find resources. If you have not found your resources as of yet, that information is available on our DCH website. I've said this in other presentations. You don't have to write this down. Just go to Google and put in DCH GA EVV or just DCH EVV. It'll be the first thing that pops up. And you can go to our website and all of the information is out there. This is the EVV mailbox, evv.medicaid@dch.ga.gov. I do monitor and respond and other folks to that email. It's mainly me. I think I was caught up with everything as of about noon today in the EVV mailbox. But there's a lot coming in right now because we're getting close to that 7-1. There's all kinds of materials there. Again, I want to reemphasize this presentation will be posted to our website along with the audio recording. So you will have it there, or anybody who missed it, you can make sure to tell them to go to the website so they can listen to it as well. Okay, that should get us to Q&A if I'm not mistaken, and it sure does. And we just want to leave this up here. So Lee Clois or Katrina, if you want to go through the Q&A.
Yep, I can read the questions off. We've got several, but I'll start from the top. You guys can tell me if you want to guide the people to the website or another resource, and I can put that in the chat as a response, or you can take the option of responding. But the first one, how does EVV handle if you clock in and out a few minutes earlier or later than your shift?
Oh, it captures when you clock in and clock out. So we pay for the time when services are performed. We are right now working to set some standard rounding rules, which are essentially 7 or less go down to the other 15-minute unit.
Okay. Next question, can you still use the web time entry when your aide forgets to clock out or no cell service or forgets their phone?
I think Katrina went over that one in her presentation.
Mm-hmm. All right, let's see. I have already started using EVV, but when staff signs in using CLE but works 2 hours and 59 minutes, it won't approve and we have to manually enter time. If we work 3 hours and 1 minute, then that may cause overtime. Is there a better way than to have to edit these punches frequently? And Brian, I believe you just referenced that with the rounding rules.
Yes, I think Katrina, if you guys probably want to take that back and look at it as well.
Yeah, and I think this is also kind of referencing the difference between a CLE, which is the extended shift, which is 3 hours or more, or a basic shift, which is under 3 hours. And I know we have kind of, sometimes you think that the employee is only going to be there for less than 3 hours, and life happens, and sometimes it goes more, that particular shift goes more than 3 hours. And we get questions about this frequently. If that happens, and make an adjustment on the portal.
Yeah, and so we will capture that and use it for the DBHDD training that we're going to do, that we have started to build as part of the EVV process.
Okay. Next question, what is the maximum number of hours for a shift? Is it 10 or 12?
I'm a little confused by that question. So let me take that one back. And I know the person who has asked the question. They've asked me several questions directly to my email and to the EVV mailbox. So I'll follow up with you and get more information on that one.
Okay. All right. Who pays overtime? Hold on, sorry. A new question came in and made me lose my. All right. Who pays overtime? Acumen out of authorization funds or employer out of his personal funds?
I can take this one. So if, I guess the state has always said, you really shouldn't be working your employee overtime. They don't give you additional funds to pay an overtime rate, which is time and a half, to your employee, but it happens sometimes. And the Department of Labor Standards says that if you work your employee overtime, that we have to pay them overtime. The funds for that do come out of your budget. So just make sure that you are aware of that, and you will be able to see the funding that's paid to your employee on the administrative portal of the website.
Thanks for that, Katrina. Let me stop here for a second, because there is a policy restriction against paying for overtime. Like Katrina said, we understand things happen and it may be necessary. It should not be standard practice. If it is standard practice, we will start looking at that from a compliance to participant direction policy, because that is a point that is very clearly outlined in our policy. Again, we realize things happen, but it should not be standard practice.
Okay, thanks, Brian. We are approved in using the home landline EVV. Do I have to submit a schedule to DCH, or can we maintain a paper schedule in the home in the event of an audit?
You don't have to submit a schedule to DCH, but it is a requirement that you have a schedule.
Okay. How soon after an employee clocks out will their shift information be accessible on the portal for employer to view?
The process usually takes about 15 minutes.
Okay.
So within 15 minutes, you should be able to see that shift information on the portal.
I'm just going through, there's several questions here that are the same, but you guys have gone through them. So what happens when change of shift and there is overlap in time? I'm not sure if I want to see that that's just a literal question. And I think you guys have answered that in terms of rounding as well.
Well, you may want to write me that question directly, because let's say that you're an overlapping of a shift, like if it's two different people,
yeah,
we have to authorize 2-on-1 services. So we would need to know what is the circumstances of 2-on-1, or if you're dropping the person off at, say, CAI or CAG or another service, then when you drop that person off, that should end your shift. There shouldn't be overlap there. So you may want to write me and give me a little more information about what's actually happening out there right now.
okay. And point of clarity, I've gotten this, I see this question a couple of times. Which app is the one we should we use? The TELUS app, DCI, or others? Which one specific to this group?
Acumen client should be using the DCI EVV mobile app, which is available on the Apple App Store if you have an iPhone and on the Google Play Store if you have Android.
Okay. Does an EVV compliance shift become approved without manager approval?
Can go into an auto approved status if you're successfully using one of the verification methods at the end at the clock out, at the point of clock out. So when I say verification methods, I mean the PIN or password, the facial recognition, and soon to be the signature option. If you don't use one of those, the employer would have to go to the administrative portal and manually approve that shift.
Okay. This is a more personal one. My son is dropped off at CAG while I'm at work and he can't input a PIN. And I see several scenarios that are in here that's kind of similar to this one. How is the employee's time approved daily?
If it's specific to CAG, that does not have to be submitted in an EVV compliant manner, only the community living services and the personal support services. But again, you can certainly use that mobile app for CAG services, for any other service really. That could be approved on the administrative portal. So you don't have to use one of those verification methods. The employer can approve that CAG shift on the administrative portal.
What are the instructions for setting up a PIN? Is that going to be on the Acumen website?
Yes, that is on the website, and I believe we have some of those answered in the frequently asked questions that we're going to be sending out next week.
Okay. Another scenario, which seems to be in here a couple more times as well. Family goes away for a vacation. If a caregiver stays, someone entered a question and I lost the question. All right, I'll see if I can get back to it again. But let me try to find another one while I'm looking for that one.
While you're doing that, Lee-Clois, I think that might have been leaning towards a PAR submission, and the PAR shifts do need to be paid out of your community living services, but I believe Brian had addressed this at the beginning of the presentation. PAR is not subject to EVV compliance because of the nature of that particular service.
That is correct.
Okay.
I want to answer a question that I see here because some folks are still confused about travel time. So let me be clear. You shouldn't be clocking in until you're delivering a service to the member. So when you're picking that member up, that's when you would clock in, whether it be in their home or in the community or wherever. That's when you would clock in. You would not clock in from your home, my home here in Lilburn, and then drive to Tucker. I would not clock in from my home address. I would clock in when I got to the member and was there to pick them up or deliver services.
Okay, another question, how will EVV process corrections?
So if you realize that, we have some people who you remember to clock into your shift, but that employee might forget to clock out. You can process any type of correction on the web portal, and then you would just choose one of those reason codes. And in the example that I provided, there's a reason code that says employee forgot to clock out, and that's your reason for having to submit that shift on the portal. So that would be a good example of a reason why you would have to use the portal and submit a shift that's in a non-compliant manner.
Okay, and just to be clear, when you're speaking of the portal, you're talking about the DCI portal.
That's correct. I'm talking about acumen.dcisoftware.com. And the login, if you're currently using the portal but not using the app, the login is the same for both.
I want to address another one real quick, because this is a question that I get a lot of times from in the participant direction world. You can receive PSS services if you're not in the States. Like if there's some reason why the person is away for treatment and you're taking your aide with you, or some sort of vacation and your aide is with you. You cannot receive Medicaid services out of country. We have written guidance from CMS that says that is not allowed. Medicaid services cannot be paid for a member who is out of country, whether they be on vacation or otherwise. And that has come up very frequently. And Lee Clovis, I know we're getting close to time here. It's by mine, it's 6:57. So I'm going to go ahead and stop. I realize there's 109 questions. A lot of these questions are repetitive, and many of them are policy questions and not specifically related to EVV. What we'll do is we will capture all of these questions, and we will use them to inform a Q&A from this training. And where necessary, we will personally respond to your questions. And again, you can utilize this email address right here, and I will personally respond to you on policy questions, because I read every single email that goes into this email box. So if you want to have your questions personally answered so you have it in writing, please do write to this email box if you don't want to see it just in a frequently asked question. Again, I want to thank Katrina and the folks from Acumen for all the work they did for the presentation and their time today. I want to thank you all on this webinar. I know we've had previous self-direction webinars. We had one a couple of months ago. I did one about a year ago with families as well, but I know that there's a lot going on, and sometimes you don't get all of the presentations and information. So I really do want to thank everybody for joining us today, and I hope you have a great rest of the evening. Thank you very much.
Thanks, Brian. Thanks, Katrina.
Thank you.